Good evening, everyone. Thank you for joining us for our webinar on obesity and COVID-19. Why does obesity increase the severity of this disease? This is a presentation by Dr. Margarita McDonald, the Medical Director of the Bariatric Medicine Institute. I will introduce Dr. McDonald to, my name is Bethany Pavisi, and I will be your moderator for this evening. In a minute, I will introduce Dr. McDonald to those of you who may not know her as yet. Before we get started with the topic tonight, we will cover a few housekeeping items. First, we encourage everyone to connect with us through our social media sites, our LinkedIn, Facebook, and Instagram, as shown on the screen, as it is a great way to stay up to date on the latest news and health-related information coming from us. In addition, please check out our website since it will be regularly updated with new content as well. Second, let's cover how you can interact with us during tonight's presentation. We do encourage you to ask questions, and we will do our best to answer as many of them as we can. With Microsoft Meetings, if you're not familiar, there's a few screenshots that we'll go through. To ask a question, you can locate the chat box on a taskbar that appears as you move your cursor over the screen, or that taskbar may already be shown at the bottom of your screen. As you click on the chat box icon, as indicated by the arrow, this will pull up a sidebar on the right-hand side of your screen. You can then type any questions or comments during the presentation. By pressing the Enter key or the send arrow icon, your questions, comments will pop up in the chat box. This is also the spot to ask questions if you're having any technical issues. We will be monitoring the chat box throughout the presentation and will to address as many of your questions or issues as we can. However, if there are any unanswered questions by the end, we will send a follow-up email to address those questions after the presentation. To receive a follow-up email, please be sure that you have registered for this event on our website so that we have your email address. In addition, the handouts and a PDF of the entire presentation will be uploaded in the meeting chat, which you can then download to your device or print. However, if you prefer, we can email those handouts and the presentation slides directly to you if you request it. Okay, so where the arrow is now pointing on your screen, that is where the handouts and the meeting slides will be uploaded. So you can check out that part of the meeting chat when you are ready to download. Alternatively, you can simply raise your hand to ask a question during the presentation if you don't want to use the chat box. To do this, click the taskbar icon with the 3 dots and then click the raise hand option. However, you may automatically have a hand icon on your taskbar. It depends basically what version or what browser that you're using, how things are displayed. When you click the raise hand option, we will have notification, and then when possible during the presentation, we will then unmute you and invite you to ask your question, or you can unmute yourself when we invite you to do so. So that should cover the main housekeeping issues for tonight. And without further delay, I will introduce Dr. McDonald. Dr. Margarita McDonald is Medical Director of the Bariatric Medicine Institute a physician-led multidisciplinary weight loss center. She earned her MD from Tufts University School of Medicine in 2005 and has completed a family medicine residency at Abington Memorial Hospital. She is a board-certified physician in both family medicine and obesity medicine. In 2020, Dr. McDonald opened the Bariatric Medicine Institute after seeing a gap in patient care with regards to obesity. BMI was built on the four pillars of health: metabolic, nutritional, psychological, and physical. Her role as medical director is to ensure patients are as metabolically healthy as possible, prescribing of anti-obesity medications, monitoring lab results and vitals. Dr. McDonald also leads the multidisciplinary team to develop individualized plans for people who struggle with obesity. And now, Dr. McDonald, I will turn it over to you, our presenter for tonight. Thank you.
Thank you, Bethany. Thank you for such a lovely introduction, and thank you for everybody who has joined us this evening. Hopefully you are able to figure out how to log in pretty easily and you weren't having any difficulty there. Just one more housekeeping issue. If you do look in the chat, the slides were uploaded at 6:40. So if you scroll up a little, you'll be able to see slides that were uploaded by Carla Renee Garrett. So thank you for joining the Bariatric Medicine Institute tonight to learn more about how obesity can increase the severity of COVID-19. By the end of this presentation, we hope that you understand how obesity is actually a disease. It is not a personal flaw or what somebody looks like, but it's a disease process that can metabolically affect the body in many ways. We also hope you have learned more about SARS-CoV-2, the virus that causes the disease known as COVID-19, and ways that you can decrease your risk of severe illness. On December 30th, 2019, a group of patients with pneumonia of unknown origin was observed in Wuhan, China, and reported to the World Health Organization, or the WHO, in Beijing. By January 2nd, 2020, the full DNA sequence had been published, and the Chinese National Health Commission warned of its potential danger. By February 11th, 2020, the WHO gave this virus the official name SARS-CoV-2. The disease process it caused was named COVID-19. The first COVID-19 patient was diagnosed in the US in late January. Since then, the United States, and these stats are as of yesterday around 2:30 p.m., showed over 19 million cases of COVID-19 infection, which is around 5.87% of our population, over 330,000 deaths, which is about 0.1% of our population. And just yesterday, by 2:30, there were 108,500 reported new cases, which was a 0.6% growth from the previous day. Most of you had heard that older adults and people with underlying medical problems, such as diabetes, heart disease, are at higher risk for having more serious health conditions, more serious disease process for COVID-19. However, even if you're feeling healthy, just being overweight can increase your risk of severe infection. Research is starting to show that obesity is the #1 risk factor for developing COVID-19 in people under the age of 55. Having a BMI of 30 or higher increases a person's risk of developing a severe case of COVID-19 by 27%. A BMI of greater than 40 or higher doubles a person's risk. And if you look at the green bar up at the top, a BMI of greater than 45 quadruples this risk. Obesity is often mischaracterized as a lifestyle choice, while it is a complex chronic disease that's resulting from social, environmental, genetic, and behavioral factors. In a future lecture, we will teach more about the disease process known as obesity. What most of us do know is obesity is at epidemic levels in the United States and most of the westernized world. Nearly 3/4 of adults, nearly 75% of adults older than 20 years old in the United States meet the criteria for having overweight or obesity, and 42% meet the criteria for obesity. It is estimated by the year 2030, the rate will be up to 50%. More than 9% of the US population met criteria for severe or class 3 obesity with a BMI of 40 or greater, and this was higher in women than in men. Other westernized countries have also noted an increased prevalence in severe obesity. The prevalence of class 3 obesity was highest among adults in age 40 to 59 compared to other age groups. Obesity now costs the US government $1.4 trillion. These costs come almost entirely from complications that result when obesity goes untreated and progresses to a disease to cause other diseases. The money spent on evidence-based medical care to treat obesity itself is negligible by comparison. $64 billion spent on weight management compared to $1.4 trillion spent on consequences of the disease. Most of the estimated $64 billion spent on weight management was direct consumer spending on diet and weight loss products that have little long-term effect on the progression of obesity. For the most part, health plans resist paying for obesity care and then pay tremendous sums of costs for the complications of untreated obesity. I'm going to pause right here for a technical glitch. I need a charger for my computer. Hold on.
As we're paused at the moment, does anyone have any questions yet? Feel free to type them in the chat or raise your hand at any point.
Thank you, Bethany. That was a little pause on my part. So back to the presentation. Obesity is second only to cigarette smoking as a leading preventable death in the US. Nearly 1 in 5 deaths of Americans 40 to 85 is attributed to obesity, and that rate is increasing. A person is considered to have overweight or obesity if he or she has more body fat than what's considered healthy for his or her weight. A quick measurement called a body mass index, or a BMI, is used as a screening tool for obesity. Obesity in adults is defined by the CDC and the WHO as your weight in kilograms divided by your height in meters squared, and it's just rounded to the first decimal place. Those that struggle with overweight are between 25 and 29.9, and for obesity is greater than 30. Obesity is then subdivided into 3 classes: mild, moderate, and severe. For mild obesity or class 1, it's between a BMI of 30 and 34.9. For moderate, it's between 35 and 39.9. And for severe obesity, it's greater than 40. Now, what we know about obesity is that it has been well documented that it is a pro-inflammatory disease. People with obesity are commonly shown to have an unbalanced or inflamed immune system. This is one of the reasons that when I'm first assessing a patient for the treatment of their obesity, I screen for certain inflammatory markers. The blood often has higher levels of several of these inflammatory markers, which are similar to COVID-19 responses in the body. This may mean their immune system is more likely to overreact to the coronavirus infection. Adipocytes, which is the true term for fat cells, increase in number as a person gains weight. As the numbers grow, the interactions between white blood cells and these adipocytes within the adipose organ increase and are responsible for increased inflammation. The inflammation seen during obesity affects immune function and is responsible for other disease states as seen on the screen on the right, leading to premature death. As we are learning more about SARS-CoV-2, we are learning that much of the process that is known as the COVID-19 disease is related to inflammation. There are many theories about how SARS-CoV-2 increases inflammation in the body. There is one inflammatory cell called a cytokine, which becomes elevated in severe disease. Obesity is also known to cause extra production of cytokines. When this enzyme increases in great numbers, it's called a cytokine storm. A cytokine storm occurs in other diseases such as the flu, pneumonia, and sepsis, and has been studied in great detail and is associated with poor outcomes and organ damage. This may partly explain the severity of infection in patients with obesity. Now, once the SARS-CoV-2 enters the cells, which is up at the pink upper left cell over there, it causes cell death, which if you follow it, goes over to the pink cell on the right. These dying cells release the cytokines. The cytokines then activate macrophages. Those are the green cells on the bottom left corner. And the virus itself can activate these macrophages also. The macrophages in turn recruit T cells, which are over at the bottom right-hand side, which then activate more macrophages. So this becomes a positive feedback loop that leads to what's called macrophage activation syndrome, and as a result, mass inflammation. Research has been showing how COVID can affect all of the different systems in our body, most of which are through an inflammatory process or a process that's aggravated by inflammation. The heart, inflammation of the heart and damage to the muscle can cause heart attacks, abnormal heart rhythms like atrial fibrillation and heart failure, of which obesity in of itself can increase these risks. In the blood vessels, blood clotting pathways are aggravated, which can lead to blood clot formation. The blood clots can then travel to anywhere in the body and cause damage. The kidneys can have damage from just the inflammation itself, from blood clots, decreasing blood supply, or from decreased oxygen in the blood from damage to the lungs. And all of this can lead to organ failure and dialysis. In the brain, you can have strokes and seizures from inflammation and from blood clots. And interestingly, one of the central nervous system issues seen is the loss of the sense of smell and taste, which is very unique to COVID-19. In the lungs, you can get pneumonia. The lungs become inflamed and filled with fluid, which decreases the ability of the lungs to deliver oxygen to the body. At baseline, obesity has been associated with impaired function of the lung because of excess weight that can be on the chest, excess weight that's pushed from the abdomen up to the diaphragm, and these can correlate to cause a disease called obesity hypoventilation syndrome, which will increase the risk for someone in any type of lung disease. And finally are the intestines. About 20% of patients will have diarrhea, which is a symptom of inflammation of the intestines themselves. Research is showing how the SARS virus goes into human cells, and it's by binding to receptors called ACE2. In patients with obesity, at baseline, there's overactivity of a system that makes this enzyme. The amount of ACE in adipose organ is higher than that in the lungs. And this allows for the entry of SARS-CoV-2 into adipocytes, which makes the adipose organ an important reservoir for the virus. This may allow for the spread of other organs, and it also suggests that adipose tissue may be more vulnerable to the SARS-CoV-2 infection than the lung cells themselves. The relationship between ACE2 and SARS-CoV-2 is 7 times higher than that in the regular coronavirus, which causes the common cold. If you add obesity and then diabetes, which also has an elevated ACE2 expression, it could potentially increase the severity of the disease even more. Cells that express ACE2 are also connected to scarring of the lungs and why the lungs can have such serious disease. Symptoms of COVID-19 include fever, dry cough, and of course the inflammatory reaction in the lung. Most people who contract COVID-19 get mild flu-like symptoms, if any at all. However, for others, it can develop into a severe case of pneumonia that can lead to death. Once the virus has entered a cell, it starts making more copies and releases new virus to infect other cells in the lung. This can happen without the patient being aware, which is the incubation period. And also, as discussed on the previous slide, this can be happening in the adipocytes also. And this is one of the reasons COVID-19 has been able to spread so efficiently. 15 to 20% of COVID-19 cases, the cytokine storm occurs in the lungs. This is thought to be due to higher levels of ACE2 receptors. Its research has been showing that higher levels of these ACE2 receptors is matched with a more severe process in the body. Higher levels have lead to constriction in the lung and increases in inflammation that leads to damage to the lung cells, fluid collection in the lungs, pneumonia, and possibly death. At this point, normal fluid in the lungs that keeps the alveoli open, which is called surfactant, has been replaced with pus-like fluid containing proteins and debris of dead cells, and this further blocks oxygen delivery. The lung alveoli, where your oxygen gets delivered to your bloodstream, then collapse. This can lead to a decrease in the oxygen of the bloodstream. If this happens, patients need to be placed on a ventilator for help. Patients with a BMI of greater than 35 have a 7-time greater risk for ventilation than patients in a normal BMI range. Sometimes the fluid in the lungs will enter the bloodstream and lead to all of the body's organs failing, which is called multi-organ failure, and eventually lead to death.
Dr. McDonald, before you move on, I just wanted to ask the participants if everyone is able to see the slides advancing, or are you advancing yourself as you go?
The slide is advancing.
Okay, thank you very much.
Okay, so what do we do now? So the pandemic is here, this disease is here, this disease can be very horrible. What are things that we can do to prevent this infection, and what can we do while we're still in a pandemic? So one of the first steps we can do is increase our physical activity. There's a large amount of evidence supporting the role of physical activity in decreasing inflammation with people with overweight and obesity. And there's no lower threshold for how much you need to see a benefit. That means that any activity helps. Okay, I see here someone has, their slides are not advancing. Give me 1 second here. Right now, what slides does everyone, can you raise your hand if you are not looking at a woman with a jump rope and with a sign that says increase your physical activity? Does everybody, I'm assuming then, since I see no hands raised, that everybody does see that? Okay, sorry. So there's no lower threshold for the benefits of physical activity, and that means that any form of activity can help. Most people, this is mostly seen in studies for heart disease. It has been shown to prevent heart disease, improves the outcomes for patients who already have it. As you can see on the top right graph, as your physical activity increases, which is the bottom line where it says leisure time physical activity, the death rate or the mortality rate decreases. And if you look on the left-hand side, that's what's going on there. And there's such a steep drop in the beginning that it just shows that that number 10 is hours per week. And if you were to divide that up, that drop is from, you know, it looks like it's around 1 to 2 hours of physical activity a week. Survival rates are improved regardless of BMI when fitness is preserved. Therefore, improving fitness through physical activity is needed for prevention of all complications related to obesity. The next step you can do is take a look at what you're eating. Learn to read your labels. Figure out what's actually in the food that you're eating. Cut out inflammatory foods, which can cause inflammation, such as ultra-processed foods. Ultra-processed foods are things such as Doritos, chips. They are formulations of ingredients that, besides salt, sugar, oil, and fats, include these food substances that you would never use at home for normal cooking, such as flavors, colors, sweeteners, emulsifiers, all these other additives. In America, we actually tend to eat most things that are no longer recognizable as plants. 57.9% of Americans' caloric intake comes from ultra-processed foods. Ultra-processed foods are replacing more nutrient-dense foods and leaves people feeling overfed, undernourished, and inflamed. So another thing would be to increase anti-inflammatory foods. To reduce the levels of inflammation, aim for an overall healthy diet. If you're looking for an eating plan that closely follows anti-inflammatory eating, consider the Mediterranean diet, which is high in fruits, vegetables, nuts, whole grains, fish, and healthy oils. And some examples are tomatoes, olive oil, spinach, kale, collards, almonds, walnuts, salmon, mackerel, tuna, and a slew of fruits. And then get plenty of sleep. Sleeping less than 7 hours per day is associated with an increased risk of obesity, diabetes, high blood pressure, heart disease, stroke, and frequent mental distress. And less than 7 hours is actually counterproductive to weight loss. And in a time of a pandemic, when there is a lot of mental distress, what we do not want to do is sleep less and not be able to tolerate things at the same level that we normally can. One more step that we can do is to take the vaccine. The good news is that the US has 2 COVID-19 vaccines that have been shown to be highly effective. The most common side effects are injection site pain, fatigue, headache, muscle pain, and joint pain. Some people in the clinical trials have reported fever. The side effects are more common after the second dose and in younger adults who have a more robust immune system. And the reason it's common after the second dose is because the second dose, your body is recognizing the first dose and responding more to that. And to be clear, these side effects are signs of an immune system kicking into gear. They do not signal that the vaccine is unsafe. To date, there are no serious long-term side effects associated with the receipt of these vaccines, and of course, things will be monitored closely. Now, there are 2 vaccines, one made by Pfizer and one made by Moderna, as if you have been watching or hearing any news, you are aware. They are both for basically adults. Pfizer can do age 16 and older, while Moderna is age 18. The efficacy between the two are pretty similar. For Pfizer, it's 95%, which starts 7 days after the second dose. Moderna is 94%, and that's 14 days after the second dose. As stated, both have 2 doses. You need to wait 21 days between the Pfizer and 28 days between the Moderna. The dose size of the vaccine is 30 micrograms, which is very small. Milligram, they're a tenth of a milligram. So 30 micrograms for the Pfizer and a little larger at 100 micrograms for Moderna. And the big difference is more the storage. So the storage for the Pfizer one, that's the one that needs the super freezers at negative 94 degrees Fahrenheit, and Moderna needs minus 4 degrees Fahrenheit. Now, both of the vaccines are messenger RNA vaccines, which are not a live vaccine.
That versus.
Can somebody please, thank you. Neither of these vaccines has preservatives. Now, these vaccines, the messenger RNA gives instructions to our cells to make a harmless piece of the virus, which is called the spike protein. That's found on the surface of SARS-CoV-2. And the messenger RNA never enters the nucleus of the cell where our DNA is kept. And so once the cell breaks down and gets rid of the messenger RNA as soon as it's finished kind of using the instructions. So nothing is truly left in the cells. Messenger RNA vaccines have been held up to the same rigorous safety and effectiveness as other vaccines in the United States. And only COVID-19 vaccines the FDA will make available in the US by approval or by emergency authorization are those that meet these standards. So COVID-19 cases, as we know, and deaths are rising across the US. We must remain vigilant. We must stop the spread of this new and dangerous virus. The more steps you and your family can take to prevent the spread of COVID-19, the safer you will be. Wear a mask, stay 6 feet apart, and avoid crowds. And just for some information for people, some of the upcoming things that we will be doing in January, we are doing educational series, habits for a healthier life. Every week we're doing something new. Week 1 is nutrition, week 2 is medical, 3 is physical activity, and 4 is behavioral health. Our first will be a blog post next Wednesday on January 6th about label confusion, learning how to read your labels. We are starting virtual exercise classes for our patients and for guests twice a week. One will be at a nighttime, one will be a morning, and the days and times will be determined. Check out our website for further information. And of course, if you or somebody that you know struggles with obesity, the next steps would be to talk to your primary care provider. There are medications on the market that are approved for weight loss. About 2% of patients that could use it actually get them. You can find an obesity medicine specialist near you who most likely would feel more comfortable prescribing some of these medications. And some of the ways that you can find an obesity medicine doctor are listed there. You could always link up with us. We're on Facebook, LinkedIn, Instagram, and you could call us. You could log into our website to find out more. We'll now open the floor for any questions. Okay, I see one question. TJR, go ahead.
Hello, Dr. McDonald. I'm just curious with the COVID-19 vaccine, are people being tested prior to receiving that vaccine to see whether they're positive? And the reason why I'm asking is because, you say that with some people could have COVID-19 and not even know that they have it.
Yeah, that's actually a very good question. Because someone who recently has contracted COVID-19 and then goes to get the vaccine will have a much stronger immune response than those that have never seen the virus. From what I'm understanding so far, this is not how we're doing it. But then again, I am not in a very big hospital system where we're receiving vaccines. I can look into it because I know for where one of the places that I work, we are going to be getting the vaccine in a few weeks, and I can find out if they have a protocol. But that would make complete and utter sense because you could possibly cascade somebody's immune system that way.
Thank you.
Yes, thank you for the question. I see that somebody else was asking about the BMI. So to calculate out your BMI, it's pretty simple, but yet not. You have to take your height and your weight, and you need to convert them to non-American standards. So you need to convert your weight to kilograms, you need to convert your height to meters, and it's your kilograms divided by meters squared. But what's probably even easier is just going online and Googling BMI calculator. You can then put your height and weight in, and it will calculate it out for you pretty quickly. Are there any other questions that someone might have regarding COVID, regarding obesity itself? Okay, well, thank you for joining us this evening. I've hoped you've walked away with some information on obesity and how it is more than just what somebody physically looks like, that there is actual disease process going on. I also hope you have learned more about COVID-19 and how severe it can truly be. And I think, you know, as this winter we're going in and it's getting colder, and it's getting hard. It's getting hard to not see your loved ones, not see your friends, not spend time with people that you actually care about. But what I would say is try as much as you can to wait till it gets a little warmer where you can do outdoor activities, just so we can try and decrease the spread of this virus. Thank you, everybody, and have a good evening. You will be getting an email with the recording. Good night, be safe, and Happy New Year.
Good night, and thank you.